Hi, this is Jay Varma, and welcome to Thermometer. On this show, I check the temperature of public health in the US and around the world, and I give you expert insights on infectious diseases and public health. Let me tell you something that may shock you. There is a disease so contagious that if one infected child walks into a classroom, 90% of the unvaccinated kids in that room will get sick. It lingers in the air, invisible, waiting, sometimes for hours, long after the infected person has left. And yet somehow we've stopped taking it seriously enough. That disease is measles. Most people in the United States, including most doctors, had forgotten about measles. It was just a rash that kids used to get and that you read about in textbooks. Unfortunately, it's now come back because of low vaccination rates. And here's the important thing. Measles can be a dangerous disease, but the most important reason we worry about measles isn't because it's deadly. It's because how easily it spreads. It spreads like wildfire. And in a world where vaccine hesitancy is growing, where government officials are questioning vaccine requirements, where public health staff and funding to make sure people get vaccinated, where people respond to outbreaks, and where we're still recovering from the trauma of COVID-19, I need you to understand exactly why measles matter so much right now. When I first started working at CDC, I learned a lesson that I've spent my entire career teaching others. And that is, the most dangerous infections aren't always the deadliest ones. They're the ones that spread the easiest. So let's use an example that all of us will unfortunately be familiar with. Think back to COVID-19. During the height of the pandemic, some people tried to downplay the threat of the virus by saying your individual risk of dying is low. What they were trying to say is that if you as an individual got COVID, you had a relatively low risk of dying from it. For some people, if you had health conditions, that might have been 1 in 100 people. But if you were fully healthy, had no other health problems, you were relatively young, it might be 1 in 1,000. So that's a meaningless statement, however, but when you're talking about the entire population of a place, when a disease spreads so easily that everybody is at risk of being infected. So let's say you live in a city of 1 million people and the death rate is only 1 in 1,000. You're still looking at 1,000 people dying from that disease when everybody gets infected. Those are people that could be alive with their families and at their jobs today. So yes, your risk individually is 1 in 1,000. But look at what might happen to your town or your city. And that's exactly why public health officials fight so hard to contain fast-spreading diseases like COVID and measles. It's because they spread so easily. Now, here's the real thing I want you to learn about and think about. What is it that makes a virus highly contagious? There are lots of factors out there, but there are 2 really important ones. First, can people spread the virus before they have any symptoms? Second, can the virus spread through the air? Measles, it turns out, checks both boxes. So let me explain. One of the reasons that COVID-19 spread so quickly around the world and could not be contained is because people without symptoms could infect other people. You could think you were healthy and still be making other people sick. Now let's look at another virus, HIV. Consider why HIV became such a devastating global epidemic. It likely spilled over into humans in the early 1900s, but was not recognized until the 1980s. And one of the reasons is that a person can be infected with HIV and not feel sick at all for 8 to 10 years. So during that time, people with HIV infection, they can spread the disease through sex to multiple other people. And when it was first recognized as a disease caused by a virus in the 1980s, tens of thousands of people were probably already infected around the world. So now let's get back to measles. One reason measles is so contagious is that it spreads before you have any symptoms. Measles can be spread by unvaccinated people who don't have symptoms because the virus has a long incubation period of about 10 days. That means after a person has been exposed to measles, the virus replicates inside the body for about 10 days. In rare instances, it can be up to 18 days before it causes any symptoms. After that incubation period, a person develops a classic combination of symptoms: but they can feel mild to some people. It can be a fever, a cough, a stuffy nose, conjunctivitis, what's known as red eyes, and a few days later, a full body rash appears. But here's the thing. A person can spread the infection for up to 4 days before they have that rash, a period when they have very mild or no symptoms at all, and then up to 4 days after the rash. Now, here's the second problem. Once a person is infectious, measles spreads through the air. So as we talked about, there are two big things that make a virus really contagious. One is, can you spread it before you have symptoms? The second is, when it spreads, does it spread through the air? And that's what measles does. Picture this. An infected person walks into a room. They cough. Well, maybe they don't even cough. Maybe they just breathe. And now they're breathing out into the air tiny invisible viral particles that float through the air, traveling along the air currents in the room. They don't settle to the ground. They don't disappear. They linger in the air, and sometimes for hours. That means you could walk into that same room 2 hours later and still get infected. And that's what makes measles so worrisome to public health people. Unlike, say, the Ebola virus, which requires direct contact with body fluids. Like you have to actually come into contact with infected body fluids. Or even, say, COVID-19, which sparked massive debates over airborne transmission. We've known for decades that measles is airborne and that it stays hanging in the air, so that it's not just a close contact virus, it's an entire room virus. And that's how outbreaks happen so quickly. The measles virus is so effective that even a tiny amount of particles themselves, what we consider 10 viral particles, are enough to infect somebody. So to put that in perspective, for many other viruses, you need thousands of virus particles to get sick. And with measles, it's just 10. And we have a way of quantifying this, of putting a number on it. Epidemiologists use a number called R0 or R0, which is the basic reproduction number to measure how contagious a disease is. For COVID-19, right now, that number is probably around 2 to 3, or it was around 2 to 3 during most of the times of the pandemic. That means one infected person would spread it to 2 or 3 others on average. But for measles, that number is between 12 and 18. So one person can infect more than 12 people. And those 12 people can infect another 12 people, and on and on and on. And that's why even just having a small drop in your vaccination rate can lead to massive outbreaks. So what do? Most important, vaccination. The measles vaccine is one of the most effective vaccines ever developed. 2 doses gives you lifelong immunity. But right now, global measles vaccine rates are stuck at around 85%, which means outbreaks are inevitable around the world. Now, here in the United States, up until very recently, vaccines were required to be in daycare, to be in school, to go to camp. And because of that, vaccination rates across most states were over 95%. But unfortunately, we've seen what happens when lies about vaccines are spread and why they're so dangerous. Because of that, people are refusing vaccines, and some cities and states are not making it required anymore to be vaccinated, or they're making it very easy for you to just say, I don't want to be vaccinated, and you don't have to get it done. And so that's what we're seeing happen right now. Outbreaks that you're seeing in 2025 here in the United States, started in Texas and spread to New Mexico and spreading elsewhere, are happening because of people refusing to get vaccinated for a disease that can be spread before you have symptoms and can be spread through the air. So what are we going to do now? If you're somebody who's been vaccinated or the vaccination rates in your community aren't improving, what else can we do? Well, we're not entirely helpless. It turns out there is something else we can do that unfortunately has been ignored for far too long. And that is focus on things that improve indoor air quality. If measles spreads through the air, then the air kind of becomes our battlefield. And that means there are some things we can do. We can improve the ventilation in a room. That means we can replace old air with fresh air. One of the standard ways to do that, open your windows. The second is what's known as air purification. That means using filters that remove infectious particles. So you can have a stand-in room air purifier like I actually have in this room right now. You can install one if you live in a big building and your owners can do it, or you're in an office building that can do it. They can install it in the central HVAC system. They can put special filters there. And the third thing you can do is you can disinfect the air. There's like kill viruses and bacteria in the air themselves. And that uses a technology called germicidal UV radiation. And in a few future videos, I'll talk about these issues in a little bit more detail. But these are the kinds of investments that don't just protect us from measles, but they also protect us from flu or RSV or COVID-19 and other respiratory infections. So there is more that we can do here, okay? In your home, that means you can get a portable air purifier to make sure you reduce the risk of viruses spreading through the air. If you have kids in school, ask your school if they've improved their ventilation. And if not, raise a stink about it. If you work in a big building, ask your leaders what they're doing to keep the air safe. Because there are lots of studies that show that upgrading the ventilation systems in buildings and in school, they don't just actually keep people safe from infections, they actually protect against pollution, allergies, and they can even help people think better. That's right. People in buildings that meet clean air standards actually solve problems better than people in buildings with poor air quality. So I want you to walk away from this video with one thing in mind. Just because a disease isn't making headlines doesn't mean it's a threat. Measles, unfortunately, is coming back, and it spreads faster than almost any other virus we know. And the decisions we make right now about getting ourselves vaccinated, getting our children and our loved ones vaccinated, about improving the air quality in our home, in our schools, in our office buildings, all of those decisions are about public health. And they determine whether we'll see history repeat itself or whether we can stop these diseases from coming back before it's too late. So if you found this video valuable, please make sure to subscribe. We're just getting started here on unpacking threats to public health, clearing out the noise, clearing out the misinformation, and focusing on the facts that you need to protect yourself and the people that you care about.